Hello, everyone. My name is Temmuz. I'm the Enterprise Account Executive at Logitech, helping out clients with their telehealth solutions regarding video collaboration within the meeting rooms, patient rooms, as well as those joining remotely. The purpose of this session is to provide sound quality virtual care experience to healthcare institutions within Canada. And I'd like to thank everyone for, again, joining us today. We have a very interesting discussion planned for all of you as we dive into the insights from the Global Virtual Care Experience Study. Today, we'll learn more about what patients and providers are experiencing and expecting from their video-enabled virtual care instructions. First, we'll share global trends in virtual care and what has made this care delivery method so compelling, both as the healthcare industry had harnessed telehealth solutions to pivot during the first pandemic, but also in how these solutions are poised for continued growth moving forward. Secondly, the bulk of our discussion today will focus on the insights from our Global Virtual Care Experience Study, where we will cover findings on telehealth usage, care types, locations, experience, and I'll discuss what technology providers indicated they're using today. And last but not least, we'll close out the session with the Q&A. So don't be shy, and please be sure to send your questions through chat, or later on you can join the Logitech booth after this call as well for follow-up questions. So with that being said, let's kick us off with some context around what is shaping the telehealth space, where we've been and where we're all going with it as well. So. Long before my time here at Logitech, I've been an advocate for telehealth. I've actually studied kinesiology in university, and I've been in the practice, I think, in rehabilitation field. I was there for around 4 to 5 years, and I've always believed in its potential for positively impacting lives in a big way around the world. And what's happening today is so promising for a plethora of reasons we'll jump into now as well. So the healthcare industry is immersed in perhaps the most rapid period of digital transformation since IT first appeared. Technological advances have completely altered the care delivery landscape, from the shift to electronic health record platforms to the use of artificial intelligence for precision medicine. Tech-enabled workflows have profoundly impacted the way providers interact and care for their patients. The COVID-19 pandemic has greatly accelerated this change. Telehealth and virtual care catapulted into mainstream as a viable, often the primary care delivery option for many services long thought impossible without any personal interaction. The catalyst of the global health crisis has made telehealth fundamental to the delivery of care. What was once a background player in care delivery is now a frontline healthcare option for patients around the world. Previously, telehealth had been reserved primarily for exceptional circumstances, delivering care where no other option was available. But necessity drove innovation seemingly overnight, as restrictive rules around payment and settings were lifted, at least temporarily, on remote care services, alleviating the burden on facilities and keeping healthcare providers and patients safe as well. With the consumerization of healthcare, healthcare organizations are recognizing now the value of consistent branding to amplify awareness, credibility, and reputation. And as these organizations start to transition to a long-term post-pandemic strategy in their continuing use of telehealth services, they seek to deliver the same quality across modalities. Now, we call that the quadruple aim. So healthcare organizations continue to be focused on leveraging technology to achieve this aim specifically. So one would be improving population health, 2 is cost-effective manner, while improving 3, patient experiences, and then 4, I would say, clinician experiences across the continuum of care as well. Looking back at, even prior to the global, pandemic that we all faced, there were many challenges facing the healthcare industry across, impacting quality, access, costs, and delivery of care services. And telehealth solutions had already started to come into the fold as a way to address them. Challenges such as provider shortages amongst an expanding and aging population, and increased prevalence of chronic conditions, as well as rising costs. Increased access to broadband globally has driven technology adoption and access into people's homes, and technology advancements at a large level led to simplified, convenient experiences for consumers, which set the stage for consumers to expect and start to demand the same in healthcare as well. All of these trends that have been putting pressures on the healthcare industry to look towards technology to meet the needs of this changing market, they were starting to look toward telehealth. But for years, it was somewhat stagnant in growth as well. And the problem was, while the concept of telehealth had been around for a long time, it couldn't catch a foothold due to many factors, perhaps most importantly due to clinician resistance and reimbursement issues. Something had to happen for there to be widespread adoption, for there to be this widespread adoption experimentation in delivering care this way. So what happened, as we look into it right now as well? So here, of course, we all know, the trigger was the pandemic. We saw a wholesale shift in clinicians leaping forward worldwide in their acceptance and adoption for virtual care tools. I recently spoke with an IT director in Toronto at a large hospital, and she shared that just before the pandemic, she had been dreading the change management challenge she was bound to face when they started offering virtual visits. And that was originally on their 2 years roadmap. And then the pandemic hit, and what was once 2 years was now happening in 2 weeks. No change management, but practically zero resistance. Of course, necessity drove this, but in turn, there's this long-term paradigm shift that came with it as well. Now that providers and their patients have had a taste, it's really lowered the long-standing resistance threshold. We've largely overcome it, and the floodgates are still opening. We're seeing in these charts on the right, with the most recent figures from Frost and Sullivan showing the expectation of continued growth, astronomical growth. Around the world, they're reporting 10, 20, even 40% compound annual growth rate for virtual care industry expansion over the next 5 years. It's quite remarkable. I mean, I think it's fair to say that the major part of the willingness to keep this care modality is the materializing of the benefits that longstanding supporters of telehealth have believed existed, but we didn't have a lot to prove as well. From lowering the cost of care, improving efficiency, creating easier avenues to receive care, catching patients earlier who would have fallen through the system until they were in acute situations that are far more costly and detrimental to outcomes, a more modern consumer-like experience for patients, and the list just keeps going. I believe that there's this positive domino effect happening here, and it's still in early enough stages to know exactly what all those secondary, tertiary, and indirect benefits will be. But there is one primary reason, and I believe that telehealth, as we knew, would never be the same again. In short, the answer is how dramatically telehealth is being shown to improve health equity. Pandemic aside, virtual care is being funded in a big way around the world by governments looking to provide remote access and telehealth solutions to reach the underserved populations that could get better continuity of care if they just had more patient-centric ways to receive it. Think hospital at home, right? So telehealth helps bridge the gaps in care delivery. All of these patient populations face social determinants of health that must be mitigated to reduce the challenges in healthcare today. If, for example, an individual can't break away from their hourly job, they're often limited to only seeing a doctor in the worst of the worst situations, when it's most expensive and least promising for the best outcome. Care must be convenient and quick to reach these populations. And convenience and efficiency are actually major themes you'll see today coming out of the study that I'm going to share with you guys as well. And speaking of the study, let's get to it as well. So here it is. So being in the collaboration, oh, there you go. Just going to change the slides. Yeah, being in the video collaboration business at Logitech, I mean, we've keenly been interested in understanding what happens to virtual care after the pandemic, right? So, and while we had a lot of beliefs on what's happening with telehealth, we haven't had the data to support it. So earlier, we went to a company called Escalent, a market research company, and we wanted to understand the impact of video in this space and understand the experiences of patients and their clinicians in using virtual care technology. So a couple of questions could be, does virtual care prioritize video and care delivery? And if so, what are the pain points? What are the major levers of impacting video experience? and do different parts of the world feel differently as well. So here's the objectives. The experiment that we've used, so this is pretty much, and the objective was we're sort of measuring video-based telehealth amongst healthcare practitioners versus patients to uncover benefits and pain points. It was a 12-minute online survey utilizing panel sample. So in this survey, there were 754 patients and 146 healthcare practitioners. This was selected among hospitals, healthcare institutions within North America, Europe, Middle East, and Asia. Our respondents, again, as I mentioned, it was doctors versus patients. But patients have had to experience video-based telehealth visit where the doctor also had to be using the video-based telehealth as well. So in this slide is just a very quick summary. You can see that the majority of the, you could say, specializing, medicine fields would be general medicine, family medicine, psychiatry, and internal medicine. So these are the sort of the specialists that we sort of saw more often in the virtual care space. All right, so first off, we asked about usage because we wanted to level set on how well versed these users were with telehealth. We wanted to know, what impacted their sentiment towards it and how the pain points differ. And we found that while they're generally very new to it, they're also adopting far more than we ever expected. So the market is in a much better position than we expected to find it, even with their inexperience. So in this sort of slide, we'll see a recent trend. So telehealth was not something, again, that was prevalent 5 years ago for either doctors or patients. And, COVID-19 has really accelerated the telehealth trend among patients. Over 70% had their first visit within the past year. And different story for HCPs. Healthcare practitioners have a little more experience within the past few years, likely as technology was beginning to penetrate with improvements in telecommunications. Patients have bought into telehealth, as we're seeing as well. Half are engaging with multiple providers. And when I say providers, I mean a lot of the current institutions are adopting Zoom, right? Microsoft Teams, Cisco WebEx, and the list goes on as well. Healthcare practitioners are now facing a new work reality with the recent emergence of telehealth. 20% of their visits in the past year have been video-based health. Doctors on average are treating 5 to 6 different care types, and 50% of doctors have utilized settings other than home or office to conduct care as well. Telehealth has broadened access to care as well. So different segments will have different levels of experience with telehealth. So some segments are newer to telehealth. So that's more on the episodic patients, one-off patients, and rural patients as well. Where some segments have more experience with telehealth as well. That is chronic and regular patients and urban patients. So these patients will have had more experience with, Teams, Zoom, etc. They're more likely to compare experiences and likely have higher expectations as their grace period is likely shortening as well. Doctors will need to focus on maintaining a professional experience throughout the video call and maintaining trust to ensure continued usage as well. All right. So in this sort of segment as well, we'll see, there are 3 main segments of, throughout the report that are early adopters and power users. So I would call power users individuals that are living in APAC, so Asia, Australia, as well as the Pacific as well, and urban patients. So they're more likely to have used with multiple providers, where chronic and urban patients, we call them early adopters, are more likely to have used telehealth between 1 to 3 years ago. Remember, the power users and early adopters, as I've mentioned, Chronic patients are likely the ideal target. These patients or repeat patients have adopted the technology and have the use case doctors are seemingly most willing to accept. And urban markets are where the larger hospital systems are, plus where emerging health tech innovations will likely appear as well. All right, so next is care types and locations. So on top of this incredibly promising usage, we also want to understand how they're using it. Where? Telehealth has been pretty, relegated to behavioral health and maybe a bit of inroads into the virtual visit space for simple visits. But use cases are shifting and expanding, and we're seeing, this so more than in trying to solve for two of the largest challenges facing healthcare: access and chronic care management. And now that's what we're seeing. These environments where care is occurring and provider collaboration is happening is helping us all rethink what's possible from practically anywhere. Let's talk a bit about what we found as well on the next slide as well. So in the next slide, we see that the doctors are primarily using telehealth for follow-up appointments, chronic management, and mental health as well. Remember how doctors were soft in telehealth, where in this slide, it sort of shows that not all care types fit with telehealth, right? So to give you an example, I'll quote one of the doctors were saying that there are applications where telehealth works and ones where it's not suitable. But I'm in psychiatry and talking is in our tool, so it is perfectly adaptable to telehealth as well. And so it's really based on care usage. So next, we'll talk about doctors are practicing out of their variety of locations, and they will need a flexible solution so they can provide consistently high quality experience regardless of location. Further emphasizing the need for quality hardware that allows them to seamlessly and flexibly provide the same experience regardless of where they're located. There are also a significant number of doctors that are operating out of locations outside of the office. So the 2 points we take away here is that flexibility and interoperability is the key, to providing, good patient experience as well. All right, next is the overall experience, I would say. So we have all these new users conducting and receiving new care types at all these locations. And what we found was an experience seems to lend itself to being willing to accept something lesser, but going forward. There will continue to be greater and greater expectations starting now at the inception point for so many users. It's a fantastic opportunity to benchmark and understand what matters to the experience going forward. So let's just get a quick snapshot of this as well. So basically, next would be, in sort of this graph, you could see that doctors or patients are satisfied and likely to recommend telehealth, right? But you can also see doctors are less satisfied than the patients as well. And, I'll definitely get to it exactly why and why not as well. So, all right, so why satisfied? Well, telehealth is simple and convenient, as I mentioned. It allows people to save some time and not leave the house. So it provided the ability for people to safely access medicine during COVID-19. Doctors are also stronger in being satisfied due to telehealth, allowing continuity of care during COVID-19 as well. All right, so as you can read the title, patients are more positive about benefits of telehealth. So I'd say doctors are much softer around the lack of in-person contact. The top 3 areas where there is most disagreement between doctors and patients all focus around in-person. So quality of care, same as in-person. Feel connected as if in the same room. More efficient than in-person, right? So doctors have already established that certain types of care are more appropriate to telehealth than others. Now, this is more of the technical experience. I think this is the one where I see a lot throughout a lot of my clients in Toronto right now. I know UHN, sick kids, they sort of, as they're sort of testing these devices, the major thing they're running into is sort of technical experience, regardless of, which OEM they choose as well. So in this case, you'll see, we're gonna sort of dive into the case study as well. So overall ease of use, right? So majority feel that the telehealth is easy to use, but patients are more likely to feel, it is as easy of use as well. Doctors feel that it is easier compared to last year because the constant evolving of technology, especially telehealth. And doctors have also been using telehealth longer than patients. So, I think when it comes sort of, usage-wise, patients definitely have more of a hard time using the technology versus doctors as well. The next slide is really about, what was similar in the previous slide. It just shows you exactly the ease of use is likely related to experience as well. All right, so with this sort of shows that doctors are much less satisfied than patients with their technical experience, as I mentioned initially, specifically with ease of connecting and video. And now this is largely dependent on exactly what, again, going back to our providers, right? Teams, Zoom, etc. What sort of exactly we're focusing on. So not everybody has their own experience, and some people love it, some people hate it, some people are in the middle as well. So, and finally, video experience as well. So admittedly, when we saw these pain points in technical experience for virtual care, I mean, we were a little bit shocked. So especially because of all things, top pain points, video, Zoom, ease of connecting, video resolution could be positively impacted by solutions we serve. By uncovering these issues and coupling with the learnings on what matters to experience, we can start to remedy together as well. So on the next slide, what I'm going to show you is basically the graph on why HCP video quality is important. A lot of doctors, looks like they seem to think that they want to look professional on camera. So something maybe of a larger resolution, right, would definitely help them. So 9 out of 10, as you see, 94% of the doctors. And as for the next slide, and again, part of the study as well is that majority of doctors are experiencing issues sometimes with their provider, but so are half of the patients as well. So doctors are dealing with multiple video related issues. That means it could be bad lighting, it could be video with audio delay, it could be low resolution, etc. as well. So turning to sort of what's sort of a good quality of telehealth solution definitely is among a right of our value as well. So as well as again, going back to video, right? So both doctors and patients feel strongly here that video experience is critical and potentially a reason to not use a particular provider. So if, let's say, Teams is not a good option, switch it up, see what sort of fits your needs as well in terms of security and network. So, and part of the last studies, obviously, is doctors. We mentioned doctors are satisfied or less satisfied. Sorry, there's 3 reasons for that. One is they feel certain types of care are more appropriate than others, which is very true. They prefer in-person care, and they are experiencing more technical issues, as I mentioned, and they recognize the issues could impact future usage. And finally, the last sort of portion would be our major learnings, right? So we wanted to know what technologies they're using. We found surprising but pretty illuminating results, right? So as I go into the next slide, right, we'll see exactly the majority of the doctors are using desktops and laptops. So questions we got to ask ourselves is, how do you sort of combine video conferencing, telehealth with these units, right? More than half of the doctors are using mobile devices, and particularly smartphones, so iPhone, Android, etc. So now you got to think about that on top of that as well. So is there a solution out there, obviously, that could benefit all workspaces and all sort of feature sets as well? Here again, it's majority of doctors are using device integrated components only as well. So I think, that being said, the summary obviously for this presentation is, I hope you'll walk away with a few key points, right? So I think what I took from it, and a lot of the projects that I'm working on currently with a lot of my clients, is that it all depends on the use case of each sort of client or department, right? Some departments would want something mobile, especially to interact with patients, right? Some clients would prefer remote, right? And then others also would be hybrid. So regardless of what they choose, obviously, it all depends. All right, so finally the key findings, right? So here it is. Patients and doctors have so far embraced telehealth as a viable option to traditional in-person visits. Both patients and HCPs predict that telehealth will increase over the next year, while some feel that the increase will be due in part to continued COVID-19 impact, and many seem to understand the benefits of telehealth longer term. While people generally find telehealth easy to use, those who often are more likely to run into technical issues as well. We also saw, and I mentioned, doctors are less satisfied with the telehealth experience. Patients overall are more positive. So, inversely proportional, I would say, for sure. Particularly higher usage patient segments. Both doctors and patients agree that they have, the video quality is the utmost important thing as well. Where also patients and doctors also agree that the video quality would improve their experience with telehealth as well. So that being said, I mean, one thing I do want to dive into is our mission in healthcare in Logitech, right? So we strive to enable virtual care and build the healthcare ecosystem for the future, right? We seek to help providers and their patients connect naturally without barriers, whether it's doctors discussing care options with their patients, providers and staff collaborating with one another, or families communicating with their loved ones. So we'll demonstrate our commitment to this by discussing a couple of topics, right? So one is the future of connected virtual care. So what that means is, the global pandemic has transformed the way the world thinks about healthcare. Collectively, we are reimagining care for the almost 8 billion people in the world, making it more accessible and effective than ever before. At Logitech, one of our primary goals is to support global health workers who seek to provide high quality healthcare. Technological advances in IoT, patient engagement, patients adopting new technology, alongside long-term changes to telehealth acceptance and reimbursement, are opening to the doors to the long-term connected care as well. Our mission is to help people make a real connection without barriers, whether it's doctors discussing care options with their patients, providers consulting one another, or families communicating with their loved ones as well. Second would be, I'd say, new patient-centered care interaction as well. So we know that patients come in every type, but one thing remains the same: is they will seek the best care delivered in the most easy and low stressed way as possible, right? So the pandemic has offered a fresh look at care delivery options as they consider with previously unrealized benefits of the telehealth coming into the limelight. Telehealth has become viable mainstream alternative to in-person care due to primarily to funding and clinician acceptance as well. At Logitech, we believe providers should be empowered to naturally build trust with patients, regardless of geography or setting. Providers should be able to deliver seamless continuity of care wherever patients need support as well. Intuitive products, beautiful design is the sort of the third option. So providers, patient interactions are sacred. So telehealth should bring both parties to feel like they're in the room together, right? So anything else adds friction. So the technology that enables telehealth connections should be simple, reliable, and seamless. So those sort of are the three core concepts that we have. One thing you guys want to definitely get away from this as well is that, going back to my earlier sort of comment, depending on the hospital, depending on the clinic, wherever you guys need telehealth or video conferencing, I'd say it really all depends on the software as well as much as the hardware. So it's the provider as well as the OEM you choose on the far end as well. So Logitech, I do believe with helping my clients, we outfitted many rooms, whether it's meeting rooms in the hospital, whether it's patient beds, hospital beds, whether it's remote workers, right? So right now what I'm using is called the Logitech TrueZone Wireless. It's actually it's wireless and it's Bluetooth, right? So people who are working remotely typically need that combination of a webcam versus a headset, and then the mice and keyboard as well, right? So again, it all depends on the environment, and definitely if you guys have any questions later on after this sort of presentation, you can definitely email me as well. So let me just go to the next slide. All right. So basically our goals, for today's webinar was really to help us all rethink what's possible in care delivery. In closing, I hope you guys, through sharing, what we've seen in the market, we help to continue rethinking and what's possible in care delivery. And, I really thank you guys so much for the opportunity to share these findings with you all. And thank you again for the eHealth team as well. And let's open it up to questions. Good question. So the question that I'm just seeing right now is, were some doctors doing visits from their home, or were they always doing it from their workspace? So, and this is just practically speaking. So just to give you a bit of a background, I am, I'm the account executive for Logitech. So my main sort of regions I do cover is Ontario, being one of them, and as well as Maritimes as well. So what I typically see across this sort of space is that, they're mainly in their workplace. Now, sometimes they're also home as well. If I would break it down, just again, providing Canadian data, I would definitely say right now, I would say 70-20, well, 75-25. 75 being that they're in the workspace. Now, if you asked me a year ago, I would say the exact opposite. I would say 25% of the time they were at their house, and 75% of the time it was in person, or it was at the workspace. Any other questions? Not that I've run into. So it was a great statement, by the way, Jennifer. She wrote, I would be interested to know if patients were asked about their privacy concerns if they live in a shared space as well, right? So great question. It all depends. So if you were, let's say, living in a house or an apartment style where you're sort of sharing spaces, or even it could be an open concept office as well, regardless of what it is. Typically, I don't want to run into any of those issues. I think the one issue I could say that I'm seeing a lot with doctors and patients is my audio is, or my video is pretty poor. How can I improve my video? Or they say, I can't hear the person on the far end well. Do you know what I mean? So this is a lot of the concerns due to, one is the robust, the product, how robust it is. So take headset for an example, what I'm using right now, right? On Bluetooth right now, no problem, I can talk fine, everybody can hear me as well. Once I step 10 to 15 feet away from my desk, and for some reason, if I'm getting coffee and I'm still in a call, an audio call, some solutions, especially, and this is not, Logitech, but it could be anything else, as you can see that the audio fades, right? And in terms of video, I see speaker tracking. So I mentioned AI, right? So one thing that, our products does is that we have something called group framing, right? So automatic framing or speaker tracking. So if you were in a room with a patient, or if you were in a meeting room, this sort of video camera can literally, let's say if there's 4 people in the room, it'll frame the entire 4 people in the room, and it'll zoom in. So it's sort of giving you that, you're almost right beside each other, right? And now once that person leaves, let's say, the last person leaves, and there's only 3 people, then the camera automatically adjusts, and now you're focusing on the 3 individuals as well. So, great question, Jennifer, but honestly, I haven't seen that case scenario as well. Many physicians in Ontario did video visits. Yeah, 100%. I really totally haven't seen it. I think, you know, my departments that I work with were mainly all the time were in the ER, or they would be utilizing the meeting room. As you can see now as well, that large rooms are not prevailing anymore. You know, back in those days, we would have probably 20 or 25 people sitting on one room, right? But now it's all huddled space, right? Or smaller rooms. I would say now a lot of the collaborative groups are 8 to 10 people only. So data is a great question. So I think with regards to data, so Logitech, I'll tell you right now, we have a Canadian data center coming up in end of June. So for instance, great question, right? A lot of people ask me, do you guys have security in the cloud? Yes, we do. We have something called the Logitech Sync. So I'm not going to get too much into product, guys, for sure. But what I can tell you is that, let's say if you guys deployed, I don't know, 100 room solutions, right? Those 100 endpoints are deployed and uploaded into the cloud we call Logitech Sync. A Logitech Sync, because it's in the Canadian cloud, in AWS, it'll also protect all your data as well. So stuff like if you want to push firmware updates, etc., this is the solution to go. And again, going back to your question, Candice, there's no issues regarding data. It only depends on which manufacturer you do select. So I'm not going to name any names, but there are some manufacturers that actually do not have data protection within their video conferencing platform. Great question, by the way. That last one, wow. Because I usually get that a lot in my calls as well. So anything else? We got 9 minutes, I believe, if I'm wrong. All right, we're good to go. Well, again, I'd like to thank you guys for your time. And, I appreciate you guys for joining. And yeah, have yourself a great day and have a great weekend. Thank you so much, guys.